So you're a hospice nurse and your full code patient codes right in front of you. Do you provide CPR? Apparently, that's the question of the day because I'm hearing that some hospice nurses are being told they don't have to perform CPR because they're protected by the Good Samaritan Law. Y'all, we need to be really, really careful with that. Every state has its own Good Samaritan law, so the exact language varies. But generally, these laws are designed to protect someone who voluntarily renders emergency assistance to a person when there wasn't already an established professional duty to provide that care. So think about like this scenario. You're off duty, you're having dinner at a restaurant, and somebody collapses. You step in and perform CPR. That's the type of situation Good Samaritan laws are generally designed to address. They're protecting you for rendering aid, not giving you blanket protection for standing by and doing nothing. Okay, so let's flip that situation. You're an RN or an LPN and you're working. You're being paid to care for a patient you've accepted responsibility for. You know that patient is a full code and that patient experiences cardiac arrest right in front of you. That's a completely different legal situation because you already have a professional relationship and a duty of care to that patient. So yes, you're going to activate the EMS system and call 911, but what are you required to do while you're waiting for EMS to arrive? You need to know the answer to that question before it happens. Know your state's Nurse Practice Act. Know what your Board of Nursing expects. Know your agency's emergency policies and know exactly what your patient's documented wishes are for every single patient. Because depending on the circumstances and the law in your state, failing to respond appropriately could expose you to not only professional discipline, but also potential civil liability. And please remember this, my company told me not to does not automatically protect your nursing license, even if they have it in a policy. An agency policy does not supersede state law or your professional obligations as a licensed nurse. It's so important that we protect ourselves in all of these situations.